when it comes to applied exercise science, when we look at most personal trainers and the education that they typically have under their belt, you're dealing with someone who's certified by an organization that has developed their curriculum to address exercise for an apparently healthy individual.
I love it. You're speaking my language. Keep going. I'm sorry. Keep going.
Apparently healthy individual. And so what does that have to do with the majority of America? Because the majority of America is not healthy. We're looking at 60% of the population have at least one chronic condition, and 40% have two or more chronic conditions.
At Active Life, we believe that the healthcare clinic of the future is the gym.
Everybody starts with the best case scenario in mind.
Never sell anything to anybody who is not in the market for what you have.
The only reason we work out is to create the opportunity to recover.
And the healthcare provider of the future is the coach.
And this is why you guys need to get paid well, because what you're doing is really, really hard work.
All right. David Rachal III, thank you for joining me on the guest show on the Active Life podcast, all the way from Virginia Beach today. Welcome to the show, my man.
Hey, Sean. Thanks for having me on, man.
It's my pleasure. I'm excited to chat with you. I would love to jump right into it. And at Active Life, we say that the healthcare solution of the future is the gym, and the healthcare provider of the future is the coach. What I would love to hear from you, because you're right at the forefront of this, is what is medical fitness?
All right, Sean. So as we define medical fitness at HEALTHEFIT, medical fitness is the utilization of applied exercise and nutrition science in a therapeutic methodology to make sure that the individual receiving the services either they're managing their current chronic condition, they're preventing a chronic condition, or they're actually treating a chronic condition. So we want to make sure that as we're providing medical fitness services, it always addresses either managing, preventing, or treating a chronic condition. But it's always the application of exercise science and nutrition science.
Okay. So for people listening to this podcast right now, most of our listeners are fitness professionals. Mm-hmm. The question I imagine they're asking themselves is, so fitness. They're going to think that, cool, David, like that sounds novel and unique when you say it, but that's what we do. So what is different about the experience that somebody would get at a medical fitness facility or with a medical fitness coach provider as compared to a standard personal trainer, strength coach, CrossFit coach, whatever have you?
Yeah, absolutely. Great question, Sean. And I answer this on a frequent basis. When it comes to applied exercise science, when we look at most personal trainers and the education that they typically have under their belt, you're dealing with someone who's certified by an organization that has developed their curriculum to address exercise for an apparently healthy individual.
I love it. You're speaking my language. Keep going. I'm sorry. Keep going.
Apparently healthy individual. And so what does that have to do with the majority of America? Because the majority of America is not healthy. We're looking at 60% of the population have at least one chronic condition, and 40% have two or more chronic conditions. So when you look at the application of personal training versus a medical exercise practitioner, looking at the difference in education and training, we're looking at someone who has either a health or exercise science degree, and this individual more than likely has been certified as an exercise physiologist, or they may have actually gotten the exercise medicine credential. So in either case, we're looking at the differences in regards to their education base and the application of what they're trained on.
So if I'm understanding you correctly, I want to make sure it's sunk into my head over here. Effectively, what you're saying is that whether the people who get certified by these governing bodies or not know it, governing bodies like NASM, NC, NSCA, ASCM, ACE, all the big players out there, they're educating people to service an otherwise healthy and capable population of people to become more fit, not teaching them how to help an unhealthy individual become a healthy individual so that they can pursue fitness. Is that accurate?
Almost. You're 99% there, Sean.
Give me all the way.
Everyone with the exception of ACSM. ACSM is the organization that sets the standards. They created the exercises medicine credential, and so they are the only organization that essentially has put together a curriculum to address chronic conditions and making sure that the end user is uniquely qualified to work with those types of patients.
Okay. And so now, did ACSM go ahead and create negotiated deals, for example, with doctors' offices and insurance companies that allow medical fitness providers, or is it providers or practitioners?
Practitioners.
Okay. To allow medical fitness practitioners to see patients, or once they see that medical fitness practitioner, are they clients? How does that work?
So with ACSM, they are a authoritative body centered around creating certifications and standards. They're not actively involved with the actual practice of exercise medicine or medical fitness. So they're simply I shouldn't say simply, Sean. They're educating. They're into clinical foundation, scientific knowledge, and the application, and they provide the information for us, the fitness profession, to go out and utilize it in the community. They have no ties to health insurance. They don't facilitate any contracts or negotiate any type of care models within the community.
Understood. So now your company, if I'm not mistaken, educates, and by the way, your company is called HEALTHEFIT, yes? Okay. And that's when I was doing my research, it was health, and I looked up health space E space fit, and it came up. So if you're looking for HEALTHEFIT, guys, you're going to find it. Your company certifies trainers to become medical fitness practitioners, correct?
Yeah, we do.
Okay. And what is the advantage? Like if I'm a trainer out there right now, I'm like, well, why would I go get what is different about my scope of practice when I'm a medical fitness provider as compared to when I'm a trainer at an Equinox or a coach in a CrossFit gym? What is different about my life if I get that done?
Yeah. So working with us and getting your certification under HEALTHEFIT's umbrella, you have several things that are going on, Sean. You have the brand recognition that has been established with healthcare. So if you're in fact interested in aligning yourself with healthcare, this would be an option for you. On the other end, if you're interested in potentially receiving health insurance reimbursements, this is an option for you. Prior to HEALTHEFIT, it's been far and few in between any type of cases, documented cases, where a medical fitness or a fitness professional has been able to work directly with health insurance. More so, and I've never heard of a organization creating or establishing a direct contract where they become an in-network provider with health insurance. And so that's what we've established. So if you're looking to, tap into another source of revenue, that, most people would love for their insurance companies to cover, quote unquote, personal training per se, then this is an option for you. This is something for you to expand your career beyond that of being a personal trainer and getting people to pay out of pocket for services that sometimes they can't afford.
What major insurance companies are paying for this right now, David?
Major insurance companies. So we're in the process of working with Medicare. So this is it doesn't get much bigger than Medicare. So Medicare, we're in the process of getting our credentialing for that. So in future tense, Medicare will become a direct payer for medical fitness services. We're also currently working, we've received reimbursements from Virginia Premier here in Virginia. We've received reimbursements from Anthem, Blue Cross Blue Shield, and Cigna.
Okay. So, and are those nationwide, the Cigna and Blue Cross Blue Shield reimbursements?
Yeah.
Okay. So I have some questions for you about those reimbursements, because I spent about a decade in chiropractic practice, working with insurance companies. For every minute I spent working with a patient, I probably spent 45 seconds to a minute making sure that I got paid for that patient from the insurance company. And one of the biggest headaches for doctors who are in network is getting paid on time, dealing with audits, and the note taking that is necessary to satisfy the needs of the insurance company to pay on the services rendered. And the doctors I know who work in the insurance networks who are disgruntled about it, and there are ones who are very happy by it as well. I want to make that clear. There's 4 sides to every story. So, they feel like they start working for the insurance company, not for themselves. It's this insurance company is going to pay me $30 on this patient unless I do this, and this with them. And they don't need that, and that, but I want to make a living. What do reimbursements look like for a medical fitness provider working with, for example, Blue Cross Blue Shield?
So on an average, if we're looking at an average reimbursement for a 60-minute appointment, so that would consist of 4 units that are billed to an insurance company. You're looking at an average of $115.
The reimbursement's $115.
It's not bad, when you look at it.
No, that's great. That's great. And what is obviously, so for people who don't know, I want to ask a question to David that I know that there's no way he can give me a straight answer to. And that is, what does it cost the patient? What is the insurance company going to pay back? How many visits they're going to allow? All that. He can't answer that because it's going to change from patient to patient based on the plan that they're on, the level of the plan that they're on, the state that they're in, the notes that you wrote to submit for the patient to get the visits cleared in the first place. All that kind of stuff is going to vary. So I'm giving you the out before I even ask the question, David. How does one get cleared to be a medical fitness client or patient of a medical fitness provider so that they can take advantage of these benefits? Let's assume they're in network already, right? They're Blue Cross. Yeah.
Yeah. Great question. And Sean, just to also let you know, in some cases, you can be out of network. So that's how we're able to work with so many insurance companies. But there's a negotiation as
yeah, we could go down that. Yeah. I was always an out of network provider, so we can go down that route.
Yeah. So in order to achieve this feat, and it is a feat, the complexities of it, you have to have a physician. A physician is the authority within this equation. The physician decides what is an appropriate treatment for their patient. So the physician has to write an order for medical fitness services.
Now, can I stop you for a second, David?
Yep.
When I was a licensed chiropractor, it was illegal for me to call myself a physician because physician is reserved for a certain level of medical licensure. Let me ask a more specific question. Are physical therapists and chiropractors considered physicians in this scenario, or is it strictly medical doctors?
These are individuals that can actually write prescriptions.
Got
so
it.
This would be your physician, your nurse practitioner, and your physician's assistant.
Got it.
So those are the only 3 individuals that can actually prescribe.
Okay, perfect. I interrupted you. I just wanted to get clarification there.
No, that's fine. So once one of these 3 individuals actually prescribes medical fitness, it has to be determined that medical necessity exists. So once medical necessity, meaning that there's an absolute need for some sort of intervention because the condition that's being treated has interrupted this person's daily activities of daily living and is essentially affecting their health. So once medical necessity has been established, the physician writes the order. They also include the clinical documentation supporting their recommendation, and that's sent to the insurance company for what's called prior authorization.
Give me the heebie-jeebies hearing that word again.
Right?
Hear that? So
you remember those days, right? So,
oh man. Yeah, go on.
So prior authorization is an insurance company essentially saying that we recognize the order from the physician. We see that there is a need for treatment, and the utilization nurse or manager on the other end of that insurance company, they have to make a determination as to whether or not they're going to approve your services based on what's been recommended and if they're going to pay.
Oh, I mean, I could tell you some stories, man. Going back to the days of trying to get visits for patients, trying to get MRIs for patients, and they said no. I'll tell you one in a minute because I think you'll like it. But what is the average number of visits that the insurance company is going to give to these patients? Because the reason I'm asking this is this all falls apart for me if the insurance company is authorizing 8, 10, 12, even 24 visits to the trainer or to the medical fitness provider, when that person, you and I know that person needs, months, if not years of rehabilitative exercise just to get to some semblance of a normal life.
Mm-hmm. Yeah. So here's one of the benefits of anyone who wants to actually work with HealthyFit. We've jumped through all the hoops to explain ourselves. And Sean, you probably know what that's like because you have to explain yourself to the insurance company as to who you are, what you do, what's the benefit for the patient. So we've done that. We've established ourselves for the most part. So then in terms of the insurance company, we've had insurance companies for say, Cigna. Cigna's like, okay, this is great. We like what you're presenting. We're going to allow you to work with this patient for 60 days. We're going to authorize 12 visits for this patient during this time period. And at the end of that time period, we want to see the results.
Yeah, but doesn't that feel sub-threshold for what that person needs? Like, I mean, we're talking about them working out once every 5 days with their trainer. Unless their trainer is saying, okay, and I keep saying trainer, I apologize. I'm getting used to using new vernacular, medical fitness provider.
Just say practitioner.
But if someone said to me, hey, I need life-saving fitness and I'm going to work with you once every 5 days, I would say it's not worth it. Like you're not getting the results that you're looking for once every 5 days for 60 days. You're just going to beat yourself up. Every fifth day, you're going to feel like it was the first time all over again. How do you help the patients coming your way in a system like that?
Yeah. So we mitigate as far as what is recommended. We've never had any issues with them accepting 2 or 3 appointments per week.
But so then it wouldn't be 12 appointments over 60 days. It would be more like 12 appointments over.
I just threw out that number.
Yeah. I got you. But I'm just clarifying.
That was something that they threw out there. I was like, well, honestly, we need to be able to work with the patient twice a week. So they need at least 2 appointments. Mm-hmm. And the appointments, once again, as you take a look at, and you understand billable units. So the billable units could be a half-hour appointment. So that's 2 units.
Right. So for people listening, a billable unit is 15 minutes. And if like in doctor land, the way that a lot of doctors will fudge it is if you're with a patient for 23 minutes, that rounds up to 2 15-minute blocks. Now you get paid for 2 units. So technically, every 15 minutes plus 8 is another unit. Is right. Effectively how you bill it. And what you're saying is they'll end up paying out right around $28 every 15 minutes.
More than that.
Well, I mean, 28 per 15 ends up getting us to what? 114? No.
Oh, you're using the example.
Yeah, that's 112 over an hour.
Yeah, I mean, that's what you're looking at. Yeah, absolutely.
It's a reasonable reimbursement rate. I'm not hating on that at all. That's a reasonable reimbursement rate. My concern is I'm picturing the client coming your way, 300 pounds, knee pain, hasn't been able to exercise because of the knee pain, is now on statins and blood pressure medication because of the obesity. The insurance company says, yeah, let's do it. Let's do 12 visits. Let's see how that goes. Well, that's like throwing a lawn chair off the Titanic.
Yeah. So sure. I mean, anyone can look at it as the glass is half empty, or you can look at it as the glass is half full. And I like to see that, with that, you have an opportunity to make a difference. and any substantial impact that you make on that individual, it can be motivating to the patient. It's like, hey, look, we have a short time period. Let's make this count. Because your insurance company, they're giving you a jump start, if anything. So let's see how we can actually place a silver lining around this scenario. So for me, it's a way of getting into the door.
Yeah.
Whereas you make that impression on an insurance company that this is a service that you can provide and you can produce effective health outcomes, because that's what they're looking for in the end.
Well, look, I believe that the insurance company is going to find that this is an extremely economical way to help their patients, even if they were to give them 45, 60, 100 visits, because what they're going to find out is that this person who was going to end up needing surgery won't. This person who was going to be on medications for the rest of their life won't. This person who might have needed late life earlier and goes on disability for a longer period of time and then depends on the insurance company to pay for it won't. So I think that the windfall financially for the insurance company is there. I have no doubt about that. And I'm in your corner hoping that you guys are able to create some headway and prove it, because I'm a fan of that, man. My concerns are when a patient would come into a clinic and they had insurance, for example, you have to charge them cash. You have to charge a patient cash, exactly what their insurance company would have paid. It can't be discounted. It can't be more, or you risk being thrown out of the insurance company for reimbursement. Is it the same for medical fitness?
Well, yes, you do. For those policies where there is a copay in place, you definitely have to charge for what you would normally be reimbursed for. So yes, that remains the same. So
right.
In most cases, what we're experiencing is 100% reimbursement due to the necessity of each case.
I'm more talking about, for people who want to understand what it means to get more pre-authorized visits, right? You get your 12. We're just going to go off the 12 for our example right now, David, if that's okay. You got your 12 visits. Insurance company says your patient, James, has no more visits left. If you believe that this is a mistake and he should be authorized more visits, please submit the following paperwork to clear that. And I imagine there's something digital that you guys can fill out, or is it all hand paper still?
Correct. Yep.
Yes. Okay. So that's just because they probably have a critical mass of providers where it makes sense for them to set up a portal online and create the punch the buttons. But they'll ask you questions like, on an Oswestry scale, how much pain was this person in before they started? At least in the medical, in the clinical world, how much pain? What pain were they in? What ADLs were they struggling to do? Can you show improvement over this period of time? Can you predict improvement over the next period of time? How many visits do you believe you would need to help this person in that period of time to achieve that improvement? Which, on paper, makes a lot of sense. Makes a lot of sense. The problem that we ran into in the clinical world, David, I'm curious if this is happening in the medical fitness world, is the insurance company would judge a clinic based on how many visits the average patient came into the clinic for. And so the game that would be played would be patient A has a $60 copay and the insurance reimburses us $15. Patient B has a $20 copay and the insurance reimburses us $80. Both Blue Cross. The one with the $60 copay, they're only getting put down for one visit. And I'll punt on the $15 because I want them to be able to look at my average and say, Sean fits in the average or below, which means he's one of the top doctors in our network and we're going to require the least amount of paperwork and pre-authorization from him. Is it the same in the medical fitness space? Is the game going to start to have to be played?
Well, the short answer is no. It's not like that. Simply, and I think it's only because this is a new service.
Right.
There's not enough data to establish any type of trends in terms of averages. So I think as of right now, I think they're open to what we have to present, and we just have to make it count.
Okay. And what is the most visits that you've seen somebody get over the lifetime of care?
Typically what we do is we'll do an authorization for 3 months. And within that 3 months, we've gotten 36 visits authorized.
Okay. That's not bad. And then how many of those patients would you say, maybe by a percentage, maybe just by a raw number, would you say stick around and continue to pay out of pocket for services that frankly, you and I both know they still need?
You know what? We haven't gotten to that point yet.
Nobody's finished their 36 visits yet?
Well, no, they finished their visits, but the outcomes have essentially transitioned that person from unhealthy to healthy.
Got it.
So then we've transitioned them into a traditional fitness program.
Okay. So, and that's what I'm asking. But now, so the medical fitness providers don't provide that fitness program that's general. They go to somebody. Okay.
Yeah,
so
we want to refer them to a community resource. So this is where the gyms, this is where personal trainers come in. So, we typically try to steer them down the healthcare continuum, and they transition into a community setting where they can continue to progress on their fitness goals.
Understood. What is the designation of healthy? So how does somebody go from I'm unhealthy, that means all these markers, to okay, you're healthy, we're going to now send you down the healthcare continuum? What is the you have passed go mark?
It boils down to blood work.
To what?
So we're taking a look at A1C levels, HDL, LDL. We're looking at pulse ox readings. So these are the biometrics that we're going by in terms of creating health.
Okay.
Blood pressure, things of that sort. So once those hit a healthy mark based on the physician's recommendations, they're done. Medical necessity no longer exists. And to our point, as far as medical fitness, that's the avenue that we're in. And we stay within that, within that concise realm of medical fitness. We don't transition over into fitness. And I think because we've been doing this, Sean, and that there's no overlap, health insurance companies, they respect that we're staying within a specific lane.
Mm-hmm. Okay.
So it's easy to digest what we're doing and who we are. We're not a physical therapist. We're not a doctor. We're not a personal trainer. So then now they can box us in and they understand what's in that box.
Right. And well, the nice thing for people who are listening, because I think one of the issues in the marketplace is ego. And ego meaning, I'm a physical therapist, which means I can also write really good training. Well, maybe you can. Babe Ruth could hit for singles. That's not what he got paid the big bucks for. And I think I've always been on the fringe of the more you can specialize, the better. I recently had a physiatrist on the show who was talking about in the area where we live, you could find a medical doctor who specializes in men between the ages of 30 and 40 with hyperthyroid issues and whatever other comorbidity. And it could get that specific. And those people are paid and they're full. And they don't start treating people who have ankle pain. But so I think it's very cool that you guys have a very clearly defined scope. What are the margins of that scope?
Would you say margins?
Meaning when does it go from being a medical provider's patient to, okay, it's now better suited by a medical fitness provider to, okay, their blood work is now good and we got that part. I know where the end of it is for you guys. But where does the beginning start?
Yeah, so the beginning begins once a patient is, they transition from an inpatient setting. So they transition from inpatient now. Medical fitness actually exists within an outpatient setting.
So we're talking about they were in the hospital and now they're coming to a
hospital. They were under the direct supervision of a physician. There's no way that they could have done, started an exercise program without that physician being present. I
see. Okay.
It was counterproductive to their health staff.
So you guys, I want to make sure everybody's clear because now it's becoming more clear to me. You're not dealing with Shirley, who's 40 pounds overweight, on some cholesterol medication because her doctor wants her to bring it down, but generally speaking, she's living a very normal life. She's not coming in for medical fitness. Is that right? Is it okay?
Nope, she's not coming in for medical fitness because she's not gonna qualify for any type of reimbursement. And, with individuals like that, when there's such, I don't want to say low risk, I mean, that's something that can truly be handled by a certified personal trainer.
Kinda. That depends.
Yeah. Well, it depends. It depends on the certification itself. Yeah.
It depends on a lot of things, but yeah. By the way, I want to tell you the story because I think that you'll enjoy it. When I used to have to put in for pre-authorizations for visits with health insurance companies, the biggest thing that they would like to say no to me for was MRIs. This patient needs an MRI. They'd be like, oh, it doesn't reach necessity for that, so denied. And I would be like, damn, they really need one. I know they need one. So I would call the insurance company, Stan Chaplak, that was my guy at United, at MPN, and I'd say, hey, look, we didn't get approved for an MRI for this patient. And I believe that if this patient doesn't get this MRI, there's a high likelihood of the following issues happening. And I would list them off. I'd be like, I just want to make sure that I have recorded documentation that you're telling me, despite the fact that I submitted this application for this patient to get this service that I believe that they need, you don't think it's necessary, so you're going to deny it. And he'd be like, yeah, unfortunately that's the case. But just hold on one second. I don't really care. You don't need to tell me. I have the patient. I'm gonna get the patient on the phone. I want you to tell them. But, hold on one second. Let me get my supervisor. Authorized. Amazing. It got authorized all the time. All the time.
That is funny.
Yeah, it's some kind of funny. But okay, so $115 is getting paid down. And I like to dig into the finances of this because I think that what you're doing is so important. And I want not only people who needed to get it, because they're not really going to be listening to this. It's going to be the people who want to advance from what they're doing with general fitness into something that is more of a clinical care, more of a clinical nature. $115 gets paid. Are they practicing in any, can it be a personal trainer at a space that they rent who has a medical fitness provider licensing who can now charge insurance companies? Or do they have to be in a facility where medical doctors exist overseeing the application of the service?
No. So once someone becomes certified and licensed, they can operate independently. They don't have to be under the direct supervision of a physician. So how it works is, as long as they're a physician, there's a physician's referral, in place and it's been authorized, that person can actually function from an outpatient perspective. So whether or not they're delivering services at that person's home, in their apartment complex, in a gym, it makes no difference as to where they're actually providing the service.
Well, the great thing about that is when we look at $115 getting reimbursed, it's not being split, 55, 60% going to the house and then 40% coming to the trainer. It's 100% going to the trainer who got the licensure and is now billing the services. If they have staff and whatnot, then of course that's their own prerogative, but 115 comes to them. They're a business owner effectively.
Absolutely.
Very cool. And what does the schooling look like to get this kind of licensure, David? I know that this is what you guys do. You help trainers get this kind of licensure and then you help them get their businesses off the ground. And I do want to get into that as well. What does the schooling look like?
So we accept individuals that have a health or exercise science degree. All right. So that's first and foremost. They got to have that in place. If they do not, Sean, we do make an exception because life can be its own, teacher. And so if we have someone who per se comes to us, they have 5 years of full-time experience as a certified trainer. We'll take a look at the individual, provided that they're able to provide 3 references stating that by working with that particular trainer, they've helped 3 individuals to, in some capacity, whether or not it be cardiovascular, pulmonary, or metabolic diseases, but they have to be able to demonstrate their knowledge, skills, and abilities through written documentation. If they can provide that, we'll take a look at someone who does not have the formal degree in health or exercise science. So that's first and foremost.
Okay.
In addition to that, we take a look at interviewing the individual because This is not all the bells and whistles, Sean, hadn't been worked out. So we have to be very careful as to who we work with and making sure that they understand that they have a high bar to actually achieve in terms of quality assurance. We're setting the stage for this entire industry. And if we do well, then everyone wins, because it'll open doors across the nation for more and more fitness professionals to become actual providers of medical fitness and working directly with healthcare.
Mm-hmm. So those are the prerequisites.
Yep, those are the prerequisites. So then once we we get qualifications, then we go into the actual training. So we have a course that covers approximately 30 diseases and conditions that can be treated, managed, or prevented through exercise and nutrition. We also incorporate, and I'm quite proud of this, Sean, I have my own exercise protocol that I developed back in 2012 called the Fire Drill. So the Fire Drill is an exercise protocol that I put together and I refined since 2012 that has been very, very efficient in terms of working with individuals and has the ability and the clinical documentation to affect every aspect of an individual's cardiovascular, metabolic, and pulmonary status. So we train the individual on that. And in addition to that, we teach them about healthcare. We teach them about the business of working with insurance companies. And that's the core part of our licensing program. So then there are no misunderstandings as far as, okay, you submit this claim, you got denied. Well, let's take a look at the different reasons why it could have been denied. You know, we never want to paint a picture that you submit a claim and you're automatically going to get paid. It doesn't work.
That's so valuable. That was the one thing that when I graduated chiropractic school, one of the things that I resented about the way that they educated us was they're like, all right, you can help people. Go do it. I'm like, okay. Oh, wait, how do I get paid?
Right.
Oh, go figure that out. I'm like, what do you mean go figure that out? Right. Yeah. And then, yeah. So good on you for teaching them the business side of things. Go ahead.
Let me say this. And I'm glad that you recognize that, because I was talking to a provider the other day. I told them one of the benefits that I wanted to make sure that we included within this is something that has never been provided to me with any fitness organization.
Yep.
There's not one certification. I have certifications.
There's one. There's one.
None of them have taught me how to make money.
That's what we do.
And what my income potential could be. Which one?
Active Life. That's what we do. That's what we do.
Well, okay. Well, I haven't taken your certification.
That's okay. Well,
I was talking about the mainstream. The mainstream.
I know. We'll think of the mainstream out there. They can be the CNNs, the Fox News, all that kind of stuff, and we'll be like the Joe Rogan podcast. That's cool. We'll be the sidebar, the fringe. Yeah, I think that's awesome, and I think that people fail to realize the schools. I mean, when I look back at my graduating class, David, I would imagine, just by a rough estimate, less than half of the people who graduated with me are still practicing. They're doing something else. They're in real estate. They're in finance. They're in medical device sales. They're somewhere else. Someone came across their path and was like, dude, you could make a living doing this. And they left. I think that's a shame. And I think that it happens because the schools don't focus on teaching the students the actual reason why they came. And the reason why I think students enroll in education that's of a higher level, especially when it's as expensive as medical or professional schools are, is that they have a relatively high level of certainty that there's going to be financial gain on the other side. And schools are selling falsehoods. They're selling falsehoods. And so I want to commend you for including that and ensuring that the students who work with you are actually getting what they're coming for, because they're not signing up for the money, but they're signing up because they want to be in the health and fitness space. And this is a great way to make money doing that. And that has to be acknowledged.
Yeah, absolutely. And that's one of the primary pain points that has driven me to really make sure that Healthy Fit is successful, because I've seen over the last 21 years, I've watched countless great people leave the industry because, like you say, they couldn't earn a livable wage.
Mm-hmm. Yeah.
It's ridiculous. They have, $70,000, $80,000, student loans that they have to pay back. And, Sally Mae, they they come knocking on your door.
They collect. Yeah, they collect, and you can't default on them.
Right.
Yeah, it's a great situation for the schools. Okay. How long is the education? Where does it happen? Am I doing this from the comfort of my couch, or am I coming to Virginia Beach?
No, you're doing it from the comfort of your couch. So we have a learning management system within our networking tool that we'll be launching soon by the name of Healthy Matrix. So we'll be launching that soon, but our licensees, they go to our platform and essentially they take the courses. They then move on. We do a direct, when I say direct, we do a Zoom, for lack of a better term, video technology training for the fire drill exercise system. And then we provide them with a multiple choice examination for the clinical and for the licensing portion.
How long does that all take? Like if I signed up today, when can I expect to be done? As we're recording this, it's what, January 8th? 9th?
Yeah. If you started today, you can expect to be finished by midpoint of next month.
Okay. So that's pretty quick.
Yeah.
Okay. And is there, sorry, go ahead.
Go ahead. The longest aspect of it is just making sure that we get you set up with all of our partners. Making sure that you set up with your electronic medical record system. Yeah, you're into that, and then, of course, we're also working with insurance companies. So we're kind of left to the speed of their accuracy in terms of getting you set up with your NPI, getting you credentialed, getting you registered with the respective insurance companies within your area. So that's the longest aspect of going through this entire process. So we've allotted 90 days to get you up and running.
Okay. Do you ever worry that that's too fast? Do you ever worry? In other words, what I'm asking you is, do you ever worry that the students graduate and they're unconsciously incompetent?
No. Simply because the people that we're screening in the beginning stages, these are individuals that have some experience. They understand healthcare to a certain degree, and they've worked in either a clinical setting or they've interned in a clinical setting. So they have some aspect of how healthcare works. And so for the most part, they come in relatively competent on healthcare, and we're just refining some of these people in the beginning. In later stages, when we become more, as we refine our education process, and we take on more people, that's something we're going to have to take a look at, and we may have to extend it out to 120 days if we're going to take on individuals fresh out of school.
And I mean, look, a month and a half could be 8 hours a day. I don't even know what we're looking at. How much education is in there? Is it an hours of content thing? Is it pass these tests and you're good to go? What does it look like? What does the education look like?
Oh, so for the course content itself, there's 30 hours of course lectures within the course, and then there's 4 hours of training for the fire drill exercise system.
Got it. Okay. And is there any kind of a ongoing continuing education necessary to stay credentialed, or is it once you have it, you?
So what we've done is we've partnered with the MedFit Education Foundation. So what we found is that they actually provide quite a few continuing education opportunities that align with the medical fitness practitioner. We're not allowing someone who's a medical fitness practitioner just simply go and get a BOSU certification. It's like, how does that enhance your ability to work with somebody, with the orthopedic dysfunction? So, it's like it has to be aligned with facilitating some sort of higher education and making sure that they can get some type of return on investment. So
speaking to that, you mentioned orthopedic dysfunctions. Are medical fitness providers managing both metabolic and inflammatory disease processes and orthopedic considerations?
They can, absolutely. Because, when we say orthopedic, we're looking at lordosis, we're looking at kyphosis, we're looking at, musculoskeletal imbalances that, you can get from taking the NASM CES certification.
We need to get you caught up on what we do. We need to get you caught up on what we're doing over here, so you can stop sending them to the NASM CES coursework for continuing ed and send them to us. We got.
Hey, man, I'm all for that, Sean, because What we're doing here at HealthyFit, we're trying to align ourselves more closely to healthcare, and with having physicians, NPs, PAs interested in what we're doing. Eventually, we want to provide CMEs versus CEUs.
Right, and so for people who don't know the difference, can you explain CEU versus CME?
Yeah, the CME is a medical education unit typically geared towards healthcare professionals. That's how they maintain their licenses and certifications. Whereas traditional CEUs within the fitness industries is geared towards maintaining your certification with the certifying body. It could be, I hate to say this, but it could be some bureaucracy behind that. We'll accept ACE, but we won't accept ACSM. We'll accept ACSM, but we won't accept an ASM. So it's not CMEs. It's more so for everyone.
Well, and to let anybody from outside looking in understand why that happens, our coursework is credentialed for pre-authorized CEUs with companies like NSCA, ASCM, NASM, AFAA, CrossFit. Every one of them charges us. And every one of them charges us, I think with the exception of CrossFit actually, charges us based on how many people we anticipate are going to go through our education for the year that may apply, may not apply. So what you're describing there is if ACE and NSCA don't play nice in the sandbox and pay each other, there's this, oh, yeah, well, that's cool. You can take those courses, but we're not going to accept them as CEUs. Okay. So you mentioned medical professionals taking these courses as CMEs. One of the things that I worry about when a topic like that comes up, David, for full transparency, is what's the value of that except to get exposed to what they don't know is out there? I don't want my cardiologist also writing my exercise program. Does that make sense? Mm-hmm. Maybe that's just me, but what is the value of getting the CMEs and educating the doctors?
Well, so the value in educating the doctors and even for them to get the CMEs is so that they have a more comprehensive understanding of what we're doing. So then they're more comfortable with making the referral. Quite a few physicians, they simply won't refer because they don't understand what we're doing.
Right.
And if they have an opportunity to gain CMEs while understanding what we're doing, we're essentially extending ourselves as an asset to them.
That's a great answer. I think it's very true. I think that the more they can be exposed to the opportunities that they have to help their patients, the more likely they are to take advantage of those opportunities. So I want to ask you about how you got into this. What made you decide I want to get into medical fitness? Let's take that question first and then I have a follow-up.
Okay. So I was a trainer when I started off at Valley Total Fitness. Do you know Valley Total Fitness?
Of course.
I don't know if you're old enough to know about Valley Total Fitness.
Of course. My first personal training gig was 2004.
Okay, gotcha. So I started off with Valley Total Fitness. And when I started off as a personal trainer, no one wanted the client that had the medical concern. They all wanted the healthy people that they can do the fun training with. And so by default, I got, I don't want to say stuck, but they paired me with, anybody who had a medical concern or orthopedic dysfunction. And eventually I embraced it. And I became that guy. So if you have a medical concern in Washington, D.C., and, you didn't know what personal trainer to go to, I was that trainer. And I began to actually develop a reputation centered around that. And eventually I rolled it into, I was independent, but I rolled it into a business. So I started off with myself, and once the demand for my time exceeded what I had available, I began hiring people to work with me. It wasn't called medical fitness back then. I was just simply, working with individuals with medical concerns. And eventually I learned how to market myself and package it. And I eventually started using the term medical fitness. So it's by, necessity that I ended up in this. I never planned on it, but it just worked out.
What education have you gotten to be able to provide other medical fitness providers with that kind of licensure? In other words,
Great So with that being said, it's being the authority in the space. I have the undergraduate degree in recreational therapy. I have the MBA in healthcare administration. And I also have 21 years of experience, along with a plethora of certifications that position me as an authority. So in this space, not to be egotistical, Sean, but I'm like, there's not many people that can tell me that I don't know what I'm doing. I have the data to back up what I've been doing. I have contracts to back up what I've been doing. And I have, tons and tons of testimonials that demonstrate my authority within this space. So, when you look at licensing and the whole process of creating a certification, you have to be able to present a viable product that you can certify people in as an expert or authority.
Yeah.
And that's what I've done.
David, if you don't toot your own horn, that horn ain't getting tooted.
Man, I try to be humble. I really do, Sean. And I try not to come across as anything outside of knowing. I know what I know, and I know what I don't know. And this is my space.
Mm-hmm. Well, look, it's about knowing a lot about a little and knowing that you know it. And then being willing to go and learn more. And I don't think there's anything wrong with being confident and telling people, I'm really good at this.
Yeah.
Like I have the experience, I have the education, and I'm constantly getting more of it. So how did you link up with insurance companies? What did that conversation look like? Did you just look at the back of your insurance card and say, I'm going to call them and I'm going to say, you should pay people to do what I do. And you should start with me. I'll prove it. And then you can work with the people who I educate. I imagine that's not exactly how it went.
No, it didn't happen like that at all. So I believe in community service. I've been working with the American Diabetes Association for 4 years. And it was while I was out at an event that I was volunteering for. It was a health fair for a church. I actually came across a representative for a health insurance company, and she afforded me the opportunity to talk to her about what we were doing. She's like, you know what? That's wonderful. That's great. I've never heard of a concept like that. She's like, I would love for you to apply to become a provider for us. And that's where it came.
Okay.
So it was just being, we were doing what we were supposed to be doing.
How long did that process take, David?
It took us 4 months.
That's pretty quick. Good for you. So if somebody listens to this and they say, look, I believe in what David's talking about. He sounds like the kind of authority I want to learn from, and that's the kind of fitness that I want to be practicing. Where do they go? How do they start?
Yeah, absolutely. So number one, they go to our website, healthyfit.com, and they fill out an application. The applications are reviewed daily by my team, and we personally go through them. We vet out the individual, we contact them, and we set up an interview process because we want to meet. We want to know who is interested, and we always get back to everyone within 24 hours of them submitting their application. So that's a simple and short answer.
Any idea how many medical fitness providers there are in the country right now?
Medical fitness providers, I don't have a number for that. However, we have exactly 9 licensed practitioners across the United States, and we just started this in November. Very
cool. Good for you, man. All right, David, where can people find you if they want more information from you or about you?
Oh, man. Of course, they can always go to the website. I'm on Facebook, so they can always hit us, connect with HealthyFit on Facebook. We're on Instagram as well. So any of our social media outlets, they can connect with us. And at the end of the day, you can always just directly email me at david@healthefit.com.
Very cool. Any parting thoughts that I didn't get a chance to ask you that you'd like to share with the audience, David?
Now looking at the pandemic, Sean, now is a great time to position yourself for future growth. No time like the present have people ever been focused on health over fitness. And if you simply want to help people get healthy, you want to expand your current offerings. So whether or not, you're a gym, whether or not you're a personal trainer, whether or not you're medical professional and you want to incorporate medical fitness into your service offerings, now's the time. It's the timing is perfect right now.
There's plenty of people who need it.
Yeah.
There's three things I think you need to look for in any kind of market that you want to tap into. Is it growing? Is there money there? And do you have expertise in it? And unfortunately, that market's growing. Fortunately, it sounds like there's some money there and there's an opportunity for you to earn some expertise. It's cool.
I'd say that's pretty accurate.
All right. David, I appreciate you joining me today, and I would look forward to having you as a guest in the future as you expand into Medicare and start dealing with that kind of stuff. I would love to hear how that works out. All right. I hope you enjoyed this episode of the Active Life podcast. If you did, please be sure to head to wherever you listened to it and give us a quality review, as well as 5 stars if you can spare them. If you want more from us, feel free to follow all of our social media accounts at Active Life Professional, Active Life RX, and Dr. Sean Pastuch on Instagram. Remember, at Active Life, we believe that the healthcare clinic of the future is the gym, and the healthcare provider of the future is the coach. We also believe that future is now. Time to grow.